Hello, I'm going to be talking about the development of an occupational therapy risk assessment scale for people experiencing mental health related challenges. With the NHS under ever increasing pressure, preventing relapse and hospital admissions has never been more critical. Occupational therapists, as we know, play a vital role in identifying the functional consequences of mental health conditions on a person's ability to cope with the demands of community living, and then problem-solving strategies or environmental modifications to reduce or manage the identified risks. The OTRAS provides a structured and robust tool to identify and quantify ADL-related risks, taking into account any carer support in place, and as such has the potential to evidence the effectiveness of occupational therapy by comparing ratings pre and post intervention. The OTRAS has gone through a pretty rigorous development process involving numerous pilots and revisions, including a focus group with 10 patients and carers to get their feedback on the tool and the clarity of the summary table. This was really useful, and we were particularly encouraged by feedback about the clarity of the summarised information. Completing the OTRAS involves two stages. Firstly, a functional risk rating for each of 10 ADL domains, 4 under the category of self-neglect and 6 under the heading of accidental harm. The OT will rate the risk level for each domain using a descriptor table. These are the descriptors for the nutrition domain. The second stage is to add a carer adjustment rating, taking into account support from informal or paid carers, the service user's cooperation with the support, and any evidence of carer burden. And this table shows how the functional risk rating would be adjusted, taking the carer support into account. So this is an example of how the OTRAS is summarised within an ADL report. So in terms of next steps, we're going to be trialling the concept of anticipated risk reduction in settings where it's not viable to do systematic pre-post evaluation. So in other words, the OT will indicate how much we would expect the identified risks to reduce if the OT's recommendations are put into place. Secondly, we're planning to write an OT news article summarising the work so far, and then thirdly, we're going to be looking for a research partner to really do the legwork in terms of testing the reliability and validity of the tool, and really to try and help turn it into hopefully a standardised outcome measure. Thank you.